If you are a senior on Social Security or disability benefits, there are two important dates you have to pay attention to. And there is a lot of change happening. I won't lie. Seniors are frustrated, and a lot of seniors don't like change because they have earned their benefits, they've earned their Social Security, they've earned their Medicare benefits, and they want things to just be progressing in the right direction. They want to be assured that their benefits that they've worked 20, 30, 40 years to earn are going to be safe. But everything that's happening in the government right now is pointing in the opposite direction. There is no assurance of safety. And that is why I'm getting a lot of emails from seniors worried about what's happening right now with their benefits. And it starts with this: the government shutdown, which has thrown a lot of things in uncertainty regarding Social Security and Medicare, and then now food stamps. So, what I'm going to do today is that I am going to unpack all that is happening right now, all the changes that are happening that are making seniors uncomfortable, that are causing a lot of seniors to send me emails and text messages regarding what's happening and what I think is going to be the next 3 months of uncertainty for seniors. And if you're wondering about text messages, how are people texting me? Well, the number you see on the screen is my text number. So if you want to join the list, text the word insider to 443-293-0080 to be added to my text list. Thousands of people are already on the list. But let me introduce myself first. My name is Kwame Kwade. I am a government benefits expert. For 15 years, I've been helping seniors get the retirement benefits they deserve. I create content on Social Security, Medicare, Medicaid, food stamps, and other personal finance topics that impact seniors and their retirement. And if you are new here, welcome. Please do me a quick favor, go into the comment section and let me know your city and your state. If you've been watching my channel for a while, I am glad you're back here. I really appreciate you. Let's jump into it. There's so much to cover. So let me tell you what I'm going to cover today. I'm going to talk about the government shutdown. I'm going to talk about Social Security increase. And the most important news of the day is that seniors have lost $12,000 in Social Security benefits because of government policy. And so if you are retired right now and you're getting Social Security benefits, there's a breaking news I want to share with you. So stay with me towards the end of this video. And then I'm going to talk about Medicare and all the changes that are happening and why this open enrollment is so critical that you pay attention. And then finally, I'm going to talk about food stamps and why November food stamps payments are not going to be sent because of what's happening with the government. So let's get started with the biggest news. So, the government shutdown is terrible. There is no way to sugarcoat it. And it appears that the shutdown is going to last all the way through Thanksgiving. You heard that right. It looks like this is going to drag on through Thanksgiving. But, there are a lot of opinions about what should be done about the government shutdown. And uh, you know, people are saying that the government should open so that everybody can get back to business. But there is a real sticky point that is going on right now. And I want to talk to you about that first because it affects seniors in a big way. And so if you're a senior citizen and you're thinking that the government shutdown does not affect you, wrong, because it does. And I'm going to show you why. But in the meantime, if you're first, this is the first time you're watching my channel, do me a favor and go into the comments and let me know your city and your state because I like to know where you guys are watching my broadcast from. So let me share with you this breaking news article that came out today from the New York Times about healthcare. And you can see why there is such a contentious issue around the government shutdown. So if you've been paying attention, the reason why the government has shut down is that the Democrats are insisting that a very big portion of the big beautiful bill, remember the big beautiful bill, among other things, took a lot of benefits away from people on healthcare. So what do I mean? If you are buying healthcare in the public marketplace, otherwise known as the Obamacare marketplace, the Affordable Care Act marketplace, it means that you are either not on Medicaid because you make too much money, you are not on Medicare because you are not 65 yet, and you are not you're probably working, or even if you're working and you don't have insurance through your work, now you have to buy insurance. And the only other place to do it, if you don't have Medicaid, if you don't have Medicare, if you don't have insurance through your employer, the Affordable Care Act allowed you to be able to buy private insurance on the marketplace. Every state have their own marketplace. You go in there, you pick a plan, you pay for it. The problem is that those plans are private plans. So imagine when you're working for somebody and they offer health insurance, most of the time they pay a big chunk of that health insurance. So what you pay out of your paycheck is a small portion of what it costs them to provide you health care. When you go to the public market and buy insurance, you are paying full price. And so, what the Affordable Care Act has done is that it provides government subsidies to allow you to be able to afford to buy healthcare on the market. A lot of seniors who are not yet 65 and qualify for Medicare are currently on the public market and have bought insurance and have gotten subsidies based on income. You get subsidies to help you afford that insurance. Well, the big beautiful bill ripped away all those subsidies for pretty much everybody. Like, they left very few people with subsidies. And so a lot of people are about to go through a lot of pain. So that is the background of what's happening. Now let's read the New York Times article so that you can see the enormous nature of the price increases, and that is at contention. So the Democrats are saying that they are not going to open the government unless that money is put back. And they don't trust the Republicans to put it back because they just took it away. The big beautiful bill was just passed about 2 months ago, and they took all that away. So they don't trust the Republicans to put it back. So they are using the government shutdown as a leverage to get that back. But now you're going to see why this is really, really important. So let's read this article together. It says consumers are facing greater costs for their 2020 ACA health coverage as Congress continues to debate whether to extend subsidies. So I'm going to go to the portion of where this is happening and you can see for yourself. Okay, so let's read this together. So it is saying that people shopping for coverage can now preview. So now states are finally releasing how much it's going to cost you on the private market to continue your health insurance plan. So if you're a senior citizen and you don't think this affects you, there's probably somebody in your family that this affects, because if they are not in a job that provides health insurance, they are in the marketplace and this is going to affect them. So people shopping for coverage can now preview the cost they will face potentially from the expiring subsidies and sharply rising premiums in many markets, including California, New York, Nevada, Maryland, and Idaho. Listen to this. Some consumers also found out that they have fewer choices because their insurance dropped out of some markets for 2026. And this is happening even with Medicare. I'm going to talk about Medicare and some of the crazy things that are happening in Medicare right now that seniors should really understand during this open enrollment season. So here is the shocker. Based on the newly posted information, a family of 4 making $130,000 in Maine would face an increase. We're not talking about total, an increase of $16,100 in annual premium next year because they will no longer qualify for the more generous subsidies. Process that information for a second. If you're a family of 4, you're making $130,000. That's not a lot of money, really. Like, for a family of 4, that is not a lot of money. You know, it means like 2 parents that are working and are making $65,000 each. That is not a lot of money. So a family of 4, $130,000, and now you are getting an increase in your health care of $16,000. We're not saying that this is the total. Even if this is the total you're paying, that's a lot of money. But that is the increase. So you divide 16,100 divided by 12, and you are being hit with $1,341 in medical care premium. Guys, remember, this is just the premium. We are not even talking about all the things that they do to even get more money out of us, including deductible, including co-pays, out-of-pocket costs, maximum, all these nonsense. But here you have a family of 4 in Maine that is going to see an increase of, you know, 16,000. Now you're probably thinking, I'm a senior citizen. This has nothing to do with me. Well, wrong, because there are senior citizens that are about to face the same thing. So let's read some more, and you see exactly what I'm talking about here. So it says older people will also see sharp increases according to his calculations. In Kentucky, for example, a 60-year-old couple making $85,000 per year will face an increase of $27,000 in annual increase. Guys, you are hearing this correctly. If you are an older couple, you live in Kentucky or any other place, you are buying insurance because you are 60 and you don't qualify for Medicare, which is 865. You probably don't have a job that gives you private insurance. And so now you have to go to the open market and buy insurance. And so now you make 85,000, meaning like, the both of you are making 45,000 each. And now you have to pay 20. You're seeing an increase. And I want to emphasize this. And if you feel like I'm very passionate about this today, guys, I am upset. I am upset because under no circumstances should we as a country be dealing with this. And this is not political. This is not Democrat. This is not Republican. I'm just speaking human facts about how it's impossible for anybody to be able to afford this. If you're a senior citizen and you're making 85,000 as a couple, and they're hitting you with a $23,700 annual increase with a straight face, it means that a quarter, 25% of your income is now going to just pay the increase. And that is just for medical care. In Nevada, listen to this. In Nevada, a similar couple will pay an additional $18,000 in premium, while Minnesota, the cost might be $15,000 more, and in Maryland, where I live, $13,700. So there is no circumstances under which this should even be something that we're dealing with. That's where we are, and that's why I think the debate that is happening right now is important. I don't know if the government shutdown is the solution, but we should not sweep this under the rug, because people are about to face this increase if nothing is done, because the big beautiful bill ripped out all these subsidies out of the public. And so we are in open enrollment for everybody starting November 1st. And so when you go in there to sign up for healthcare November 1st, this is what you're going to be dealing with. And if you don't have the money, then you have to drop your health insurance. And why should people be subject to that? Because they are being offered an unreasonable fee to pay. And if they can't afford it, it means that they have to go without health insurance at a critical age. And then we're talking about seniors here, guys. We're talking about seniors in these states that are about to see this kind of increase. So I want you to let me know in the comment section what you think. That are these health insurance increases reasonable? Are they fair? Is this what seniors should be dealing with when they've worked their whole life, 30, 40, 50 years to pay into a system, and then you get hit with something like this when all you're trying to do is just survive? I want to hear from you. I want to hear your thoughts in the comment section below. So that is the first thing that's happening with the government shutdown. And there is more. Okay, there's more. Now let's talk about Social Security cost of living adjustment. But before I do that, if you want to stay on top of all the news and updates that are happening, then join my text list. Text the word insider to 443-293-0080 and join thousands of people that are already on the list that are receiving breaking news updates, and not just the news, but how the news affects you, your retirement, your benefits, and your finances. So that is the number on your screen. Text the word insider to the number. So next, we're going to talk about the shutdown and your Social Security increase. So let me lay some groundwork here, because it's important to understand how we got here. So normally, the Social Security Administration is supposed to release your Social Security cost of living adjustment on October the 15th of every year. Well, this year, that is not possible because October 15th has come and gone. That was 2 days ago, and we still don't have the Social Security cost of living adjustment announcement. So, what is the problem? Well, the problem is that the government shutdown affected the Department of Labor. And if you're familiar with how the Social Security cost of living is calculated, it is using data from the Consumer Price Index for the urban wage workers. And that was supposed to be released on October the 15th. Well, since the Department of Labor has been furloughed, they couldn't crunch the numbers and do the surveys to get the data to the Social Security Administration. So that inflation report, it wasn't released. And so the Social Security Administration cannot calculate your Social Security cost of living adjustment. So now the Social Security Administration is saying that they are likely to send that information or release that information on October the 24th. So now we have a date, and the date we have is October the 24th, when your Social Security cost of living adjustment is going to be announced. Now, the question is, how much money are you going to get? Well, a couple of things about that. Experts are saying that you are going to get about 2.7% or 2.8% increase. That is what we are seeing. And I think it's going to be 2.8% because I think that based on the inflation report that I've seen over the last 2 years, and where things have been trending, especially this year, it will be surprising if we don't see a much bigger COLA, because everything we've seen this year regarding inflation and where it's been going has been trending up. And so, in my opinion, I don't see how the Social Security cost of living adjustment does not trend in that direction. You know, food prices are up by a significant amount, which is one of the biggest measurement of inflation. And everywhere you look regarding food, things are up. And so that's not just that. Electricity is up, rent is up, um, and transportation, healthcare. You want to see how much healthcare has gone up? Let me show you a data that will blow your mind. So when it comes to seniors and healthcare, this is how much seniors are spending right now on healthcare overall based on Social Security. So right now, the average senior is spending $6,300 out of pocket. That is 39% of their average Social Security check. And it affects men and women almost equally. And in some age groups, it's even worse. And so everything has gone up. And so it blows my mind that we are going to see a 2.8%, a tiny 2.8% increase in Social Security cost of living adjustment. And yet, everything else is going up significantly. I just showed you that it amazes me the disconnect between what the government think is going on and what politicians think is going on and what is actually going on, because the Social Security Administration is going to announce very proudly that they've done something good by giving you a 2.8% increase. And if you look at the last couple of years, Social Security increases have been very low. The average increase over the last 20 years is 2.6%, right? Last year or this year, 2025, you got 2.5%, but the average increase has been 2.6. But I just showed you how much cost has been rising significantly. And we just looked at an article from the New York Times that was talking about how health insurance premiums that seniors are paying is about to go up significantly. Remember this right here, you know, I just said older people will see a sharp increase in health insurance. 85, so a couple making 85,000 is going to see a $23,700 increase in Kentucky alone. And then the government turns around and gives you a 2.8% social security increase as if they've done something so significant. And I think that the disconnect between that is very, very troubling. But here's the thing. The same government that is giving you a 2.7% increase is then going to turn around and make you pay a lot for your health insurance, your Medicare Part B premium. So here it is. Medicare Part B premium, according to the Social Security Trustee's report, is going to be 11.6% up in 2026 from $185 to $206. And Medicare Part B deductible is going to go up by 12%. So, guys, look, I know I'm going on a rant here because I have the facts to prove it. And what I want to highlight is that there's a big disconnect between what the government thinks is going on with seniors and what is actually going on with seniors. And I'm showing you data that is showing that a lot of prices have gone up in an outrageous percentage, in an outrageous way that nobody can survive on. And yet we are being told to accept a 2.8% increase in Social Security cost of living adjustment as if we're not living in the same country and seeing inflation everywhere. But if you think I am completely out of line, let me know in the comments. If you are seeing something different, if you are living a different reality, let me know in the comments, because the emails that I get from seniors, the text messages, I've told you, I shared my text number with you. The text messages I'm getting on this phone all points to the same thing. Seniors are struggling to make ends meet, and any more cost increases that do not come with Social Security benefit or disability benefit increases are going to be crushing to a lot of seniors. And so I want to hear from you in the comments. Let me know what you think. What do you think is happening, and what kind of increase in Social Security cost of living do you think needs to happen in order for you to feel like you have you can get ahead, right? So that is the second thing I want to talk about. And let's talk about, I'm going to talk about Medicare shortly, but I want to get to food stamps because there's breaking news regarding food stamps that I want to share with you that a lot of you may not even know is happening. So if you're on food stamps or you know somebody that is on SNAP benefits, this is information that you want to relay to them. So the government is saying that food stamps benefits are going to dry up. Okay, food stamps benefits are going to dry up soon. In 2 weeks. This is the U.S. Secretary of Agriculture saying that food stamps are going to dry up in 2 weeks because of the government shutdown. And they've instructed states to suspend issuing November food stamps until further notice. Now, how many people are going to be impacted? Well, I'm going to show you a map that walks you through how many people are on food stamps in specific states. Okay. Let me make sure that I have that up for you. No, that's not it. Let's remove that. And then I'll give you a map that highlights food stamps benefits by state. And you will see that the percentage of the population receiving food stamps by state, the darker the color, the greater the number. The very dark ones are 16% or more. So Oregon, New Mexico, Oklahoma, Louisiana, Washington, D.C., huge populations on food stamps. And then the next darker ones you can see it's like a big chunk, 14 to almost 16%. Nevada, Missouri, Illinois, Nevada, Illinois, Alabama, West Virginia, Pennsylvania, New York, Michigan, etc. And then not too far off, you have Florida, Georgia, North Carolina. So a lot of the country is on food stamps, and estimates show that 20% of the population is on SNAP benefits. Why? You may be asking why. Well, is that people cannot afford to buy the basic necessities, including food. And so I pulled the report from the USDA's website to just see how many people are on food stamps really right now as we speak. How many people are on food stamps? Now, I'm gonna process this report, and then I'm going to share with you in another video. But I wanted to put it, you can't even read it, but I wanted to put it on the screen so that you can see, because the bottom number is what is important. As of May 2025, the last time they released the report, there are 41 million people on food stamps. 41 million. And if you look in some states, it's a lot, right? You look at California, it's a big state. So naturally, you would know that there are a lot of people on food stamps. But, Alabama has almost 750,000 people on food stamps. Arizona, almost a million. Illinois, almost 2 million. Massachusetts, 1.1. Michigan, 1.4. New York, 2.9. New Jersey, 850. Let's see. Pennsylvania, 2 million. Ohio, 1.4. North Carolina, 1.4. Let's see here. Georgia. Georgia has 1.3 million people on food stamps. Wisconsin, 702,000. Virginia, 835. My point is that there is a lot of people, 41 million, almost 42 million people on food stamps. So when we see a report, that the government is going to run out of food stamps in 2 weeks, you have to think that 42 million people, including seniors, are going to struggle to afford food in the coming months. So that is the next thing that's going on that I wanted to share with you. And then finally, I want to talk to you about Medicare. We are in Medicare open enrollment. If you've been watching my channel for a while, you know Chapter Medicare is our partner that we've been working with that can help you during this open enrollment season save money, $1,100 on average, but more importantly, switch to a better plan. But I'm going to share with you the changes that are happening to Medicare and why you should pay attention during this open enrollment season. Okay, so stay with me. I have about 7 changes that are happening that you should be aware of, that a lot of seniors probably are not being told what's going on, and is going to impact their benefits in a significant way. The first change that is happening is Medicare Part B and Part D. This is coming from Investopedia, where I pulled the information from. I've already told you your premium is going up by 11.6%. But here's the thing, Medicare Part D premiums are also going up significantly. So that is change number 1 that you have to be aware of, that is coming from Medicare. Change number 2, insulin prices are going to drop to $35 for a lot of people. And if you live in the state of California, the governor just announced an initiative where insulin prices are going to go to $11. So if you live in California, that is even better news. So make sure that you look into that, because that is going to be a very big cost saving for a lot of seniors that need insulin and have been paying enormous prices until recently. The third thing is going to be Medicare Part. No, that's not what I wanted to put up. Okay, deductibles. Medicare Part D. Your deductible is going up. Your out-of-pocket cost maximum is going up to $2,100. It's going up by 5%. Can you see that every price increase is in the 4-5% range minimum, yet Social Security increase is 2.8%? I know I've said this, I've beaten the dead horse to death, but my point is still remains that every price increase is in the 4-5% range minimum. And including here, out of pocket cost for Medicare Part D is going up by 5%. But here's the thing though, you can pay it on a payment plan. You can set up a payment plan and pay it over 12 months versus having to pay it upfront. So that is a good thing that is happening. So I think we should take the win when we get it. So the next change that is coming with Medicare that you have to pay attention to, let me remove this from the screen and let me go back to my file. There we go. Has to do with Medicare Advantage plans. Let me talk about Medicare Advantage plans for a second. A lot of changes are happening with Medicare Advantage. A lot of Advantage plans are leaving certain markets. Humana, United Healthcare are dropping a lot of people and are leaving certain markets. So if you're on Medicare Advantage plan, make sure that you review your plan. Your annual notice of change letter is more relevant than ever because it's going to tell you everything that's happening. So if you got that letter and you didn't read it carefully, you need to go back and take a look at it. And if you're confused about everything that's happening with Medicare, give Chapter a call today. They are waiting for your call. They're agents standing by, licensed agents that are going to offer you free, unbiased opinion to help you get into a better plan that gives you that peace of mind that I've been talking about all month regarding Medicare. So that's what's happening. So, your Medicare Advantage plan is changing, and certain things that you got for free are now being taken away, including over-the-counter medications, transportation services, nutrition. A lot of people got grocery cards, and those are being significantly scaled back, and meals. And so I think that, there's not been any good news when it comes to Medicare Advantage that I've heard this year. It's all been things being taken away, things being reduced, and it creates a lot of confusion for seniors. So if you're on an Advantage plan, and about almost 60% of seniors are on Advantage plan, make sure that you are checking that. Now, you may think I'm going to run back and sign up for Medicare, original Medicare. Well, not too fast, because there too, they are making significant changes that I don't think are good. And that's why I wanted to talk to you about all of this, because this is important for you to know. So Medicare, original Medicare, is also going to see one of the most significant changes that has ever happened in the program. And it's not good. So starting January the 1st, in 6 states, New Jersey, Arizona, Ohio, Oklahoma, Texas, and Washington, they are going to start requiring pre-approval, or what is otherwise called prior authorization. If you're a Medicare Advantage plan, you know about prior authorizations. They are going to start requiring that for certain medical services, procedures, or devices. So if you are in need of these things, you have to get pre-authorization before you can get them. One of the reasons why a lot of seniors liked original Medicare was because you didn't have to jump through these hoops. But now they're going to be using AI. As it says, if successful, the pilot project could lead to wider use of prior authorization in original Medicare, possibly using artificial intelligence. The practice is already widely used in Medicare Advantage, with some plans using AI and algorithmic software to help make coverage decisions. So now they are trying to, in my opinion, make original Medicare less desirable. Because if this pilot, they're saying that if the pilot goes well, we all know where this is heading. They are going to roll it across the country. They're going to find the data and tell us that it worked so well, it saved the government so much money, they're going to roll it across the country. Now, look, if you think this is a good idea, let me know in the comment section. Let me go into the comments and see what comments are coming in. All right. We should petition the government in order to have back our pay without quotes. Let me see. I'm late. Have they changed the COLA date? Yes. This is from Christy. COLA date is now the 24th. October 24th is the COLA date. This is heartbreaking. Why do they always target those in the lowest income levels? It's true. I mean, that's what's been happening. I mean, I'm not going to sugarcoat it. If you look at the big beautiful bill, it took a lot away from the lower income population and gave it to the extremely wealthy. And it's just facts. Look, I've told you guys I am not political. Any party that is going to do what I want to see done, which is strengthening senior programs, put seniors first, I am going to be for that. So whether it's Republican, Independent, Democrat, that's what I care about. And so I'm going to call it as I see it, but it's not because I am favoring one party over the other. I just want to make sure that seniors who have worked 30, 40, 50 years, played by the rules, and now finally are hoping to enjoy their retirement and get the benefits that they've earned, now become a stress point, political football. So that's my opinion. Just to call chapter for medical information and put on hold for more than 45 minutes is just a waste of time. So chapter has been inundated with calls. They are working through it. I reached out to them today and they said that, if you call this weekend, they are open from 9 a.m. to 9 p.m. and they are ready to serve everybody. So give them a call again. I'm sure you get a better experience this weekend. But I hear you and I apologize that you haven't been able to get through. All right. So what I wanted to share with you was all the changes that are happening. What I was sharing right now was that original Medicare is going to be changing because there's going to be pre-authorization, but that's not all I want to share. So let's keep moving so that I can share everything that I've prepared today. So change number 5 is going to be good news. Okay, there's some good news in here. So selling drug prices have been reduced because the government have negotiated drugs prices directly with manufacturers and have been able to negotiate prices on 10 specific drugs that seniors use. And so this list is from the AARP that's showing you the 10 drugs and the specific percentage savings that you're going to get. So you have, I don't even want to mention these names because I'm going to probably mispronounce something. But the point is that if you're on any of these drugs, you are getting significant savings up to 79% of some of the most popular high cost drugs. And then next year, they are going to negotiate more prices. That is going to include the weight loss drugs of Ozempic and Wegovy as part of the negotiation. So those prices are also expected to come down. So that is change number 6. And then change number 7, let me go to that. Change number 7 has to do with prescription drugs. If you're on prescription drugs, you're going to be able to sign up for a payment plan, and it's called the Medicare Prescription Payment Plan. And here's the thing. Once you sign up for the payment plan once, you don't have to sign up again. Previously, that was the problem, that you have to sign up now. No, once you sign up this year, you get on a Medicare prescription payment plan, it rolls over every year. I think that's a excellent news for a lot of seniors. It takes one more thing off your plate, one more burden in this process. And so, guys, those are the changes that are happening. So now that I've told you what is changing, let's talk about how to prepare for this open enrollment season, because a lot is changing. And if you just renew your current Medicare plan, that is not going to be a good idea, because I bet you, that even having somebody review, and you don't have to, you can do your own research. I'm going to show you can go to medicare.gov and do your own research. But what you don't want to do is just renew the plan that you have, because there's a lot that is changing, and you want to make sure that your benefits meet your need. One of the first thing you should do is review your annual notice of change plan. Gather your health information, your ID, your healthcare ID, your prescription drugs that you take, your doctor network, your provider network. And then when you speak to your Medicare advisor, you are prepared you're well equipped with the information that you need. Also, review your current plan and see what do you like about your current Medicare plan and what don't you like, so that when you speak to your Medicare advisor, you understand specifically what you want to do. So the first tip I'm going to give you, to prepare for open enrollment, which has started already, is to, avoid blindly renewing your current plan. It can change. You may feel loyal to a particular plan, but then suddenly find out that its provider network has shrunk and your doctor is no longer included. Confirm that your plan still offers the best coverage for your area and budget before you proceed. So that is the first tip I'm going to give you. The second tip is to, make sure that your medications are covered. There's a lot of changes that are happening with Medicare Plan D. And so make sure that these changes that have been implemented does not affect you specifically, right? Because the last thing you want to do is pick a plan that does not adequately cover the medications that you need. Change number 3. I think you can go to medicare.gov and do your own research. Based on what I have seen, this is what I think. If you're getting random calls from an 800 number, that is sketchy. I would rather that you work with somebody that has access to everything in your area, that is not there to sell you anything, and that is not just pushing one plan. So if they're calling you on an 800 number, I'm very suspicious of that. If they just work for one provider, I'm very suspicious because they're pushing you into a specific plan. You want somebody that sees everything and sees everything in your local area and can offer you free and unbiased opinion and then allow you to make your own decision. That is what I think is the right way to go about open enrollment, especially this year when so much has changed. And so I hope that this is helpful to you and that during this open enrollment season that you are able to get the peace of mind about Medicare that I've been talking about. My goal is to help 100,000 seniors during this open enrollment achieve that peace of mind, which means you have reviewed your current plan, you understand the changes that have happened, and if there's no change and you are confident about your current plan, then you stick with it. If it's not, you're even remotely not sure, then work with somebody. And I said, call Chapter; they'll help you. But you don't have to work with Chapter. You can go to the Medicare.gov website and find the Medicare plan and search for yourself, and you get access to everything. So you can do your own research on the Medicare website. Chapter will just make it easy for you because they are experts in doing this. So, but my point is that do your research, compare plans, make sure that you're picking the best plan for you, because the government is not going to give you the plan that fits your needs out of generosity. They want you to sort through the 24,000 plans and figure it out for yourself. That is how they keep people on the worst plans and save a lot of money. Don't let that be you. So that is what I wanted to cover with you today. I think that the bigger thing that I wanted to share was that regardless of where you are as a senior, you are being bombarded with a lot of uncertainty, a lot of changes, and it's good to just stay connected to the information that's happening. Make sure that you are up to date on everything that's going on, so that when it comes to cost of living adjustment, that it's going to be released on October the 24th. When it comes to food stamps, November may not come in, and so we'll have to wait and see what happens with that. When it comes to Medicare, lots of changes are happening, but you have open enrollment in order to get into a better plan. And so that's an opportunity. When it comes to cost, a lot of costs are increasing significantly. And so do not just look at the premium for Medicare to make your decision. Take the whole picture into consideration: out-of-pocket costs, deductibles, premiums, and then see how it affects you on a total basis before you pick or stay with your plan, or before you switch to a better plan. And the last thing I want to say is that you should act sooner, because if there's going to be changes that you want to, changes you want to make to your Medicare plan, it's better to start now. Then you have the entire, 7 weeks in order to get it done. versus waiting till the last minute and then realizing that a lot has changed with your plan and now you're scrambling to get it done. So, if you have any questions at all, you can text me by joining my text message list. Let me see. Yeah. So you can text the word insider to 443-293-0080 and ask any question you want, and we'll respond to you. We also send news updates, so you'll be receiving text messages from us. We send about twice a week, so you receive 2 text messages from us regarding anything we think you should be aware of that is affecting your benefits or your retirement or your pocketbook. So, guys, that is all I have today. If you like what you heard, hit the like button, hit the subscribe button, and I'm looking forward to seeing you on another video tomorrow. Thank you for hanging out with me today, Friday the 17th, and I hope you have a great weekend.